Excellencies, representatives, Dr. Tedros, colleagues, ladies and gentlemen, it is my pleasure to bid you good afternoon and welcome to this special 40th anniversary commemoration of the Certification of Smallpox Eradication. Thank you very much for making time on a busy Friday afternoon to be with us for this celebration moment. We are anticipating a few more participants to arrive in the next few minutes from a meeting that they are in now, and I'll invite you just to reflect on this story through the slideshow that is playing on the screens for 1 or 2 minutes before we start the formal program. I'll also remind you that we have interpretation, and I'd like to, at this point already, acknowledge our interpreters for being with us today and helping us all participate in our language of choice. You will find the headpieces at your chair or on the table or microphone, and so please make use of them. Our program this afternoon is broken into very simple parts. We will have some opening remarks and the perspective of several member states with a connection to this historic event and achievement. And we will then hear some perspectives from others working in the field to remind us about that work at that time and help us also to look forward to the future. So it is my pleasure at this time to invite Dr. Tedros, Director General, for some opening remarks. Please, Dr. Tedros.
So I would have actually preferred to have our ambassador speak first, and as a host speak after the 3 of them. I think 3 of them will be speaking, 3 of our ambassadors here. Okay.
As consistent with our transformation, we are a very agile environment and allow for flexibility and adaptability. This sounds like a wonderful idea. And it is my distinct pleasure to invite Ambassador Gatilov, the Russian Federation, please to start our remarks. Thank you.
Добрый день, уважаемые коллеги, уважаемый доктор Тедрос, уважаемые друзья. Мы признательны руководству Всемирной организации здравоохранения за приглашение выступить на памятном мероприятии, посвященном 40-й годовщине сертификации искоренения натуральной оспы. Расцениваем это как признание вклада нашей страны в победу над этим опаснейшим заболеванием. В этой связи хотелось бы напомнить, что именно по предложению СССР в 1958 году Всемирная ассамблея здравоохранения приняла историческое решение о запуске программы глобальной ликвидации заболевания натуральной оспы. Советский Союз имел успешный национальный опыт ликвидации оспы и оказывал содействие программе как в форме поставок высококачественной противооспенной вакцины, так и посредством командирования хорошо подготовленных эпидемиологов для борьбы с оспой во многих странах на разных континентах. Находившийся в Москве сотрудничающий центр ВОЗ по оспе решал практические задачи, связанные, например, с диагностикой, а также проводил важнейшие научные исследования. Достаточно сказать, что специалисты центра открыли ранее неизвестные науке оспоподобное заболевание, получившее название оспа обезьян-человека. В 1966 году фиксировалось от 10 до 15 миллионов случаев заболевания людей натуральной оспой в более чем 50 странах. Ежегодно от этой болезни умирали от 1,5 до 2 миллионов человек. Благодаря колоссальным усилиям мирового сообщества под эгидой ВОЗ уже в октябре 1977 года был зафиксирован последний природный случай оспы у человека. В мае 80-го года на 33-й сессии ВАЗ была провозглашена победа над этим страшным заболеванием. Ни холодная война, ни другие геополитические факторы не смогли помешать дружной и самоотверженной работе на всех уровнях программы. Со временем число коллекций штаммов вируса натуральной оспы было сокращено до 2. Сегодня в соответствии с резолюциями ВАЗ хранение и изучение живого вируса натуральной оспы осуществляется только в России и США. Однако безусловный успех глобальной программы по искоренению натуральной оспы имел и объективно негативные последствия. В постерадикационный период постепенно были свернуты фундаментальные исследования этого вируса и прикладные работы по созданию новых диагностических, вакцинных и терапевтических препаратов. В результате сегодня в мире сложилась опасная ситуация, когда вся популяция человечества моложе 40 лет не защищена от природной вспышки оспоподобного заболевания. В последние 20 лет в разных географических регионах все чаще происходят вспышки заболеваний среди людей, обусловленные такими зоонозонными ортопокс-вирусами, как вирусы оспы обезьян, это в Африке, оспы коров Европа, оспы буйволов Индии и оспы вакцины Южная Америка. Связано это, судя по всему, с наличием значительной прослойки невакцинированных людей. По этой причине ортопокс-вирусные заболевания сейчас подпадают в разряд вновь возникающих опасных инфекций, и более того, существует серьезная опасность появления вновь заболевания человека, вызванного вирусом натуральной оспы, в том числе в результате современных достижений науки и технологий, например, синтетической биологии. Международные исследования с использованием вируса натуральной оспы при непосредственном участии ВОЗ были реанимированы в начале 90-х годов. В рамках мандата, полученного от ВАЗ в сотрудничающих центрах ВОЗ по оспе в России и США, проводятся исследования по скринингу и разработке лечебных препаратов против натуральной оспы и других оптопокс-вирусных патогенных для человека. Создаются новые безопасные вакцины и формы их применения. Разрабатываются новые современные методы диагностики натуральной оспы. Все это делается под строгим контролем со стороны консультативного комитета ВОЗ по исследованиям вируса натуральной оспы. Любые исследования, предполагающие использование живого вируса натуральной оспы, проходят первоначальную экспертизу в комитете, и только в случае их одобрения комитетом принимаются к выполнению в странах-репозитариях коллекций натуральной оспы. За последние 20 лет в Российском сотрудничающем центре ВОЗ по оспе выполнен большой комплекс исследований. В результате появились современные системы экспресс-тестирования не только вируса натуральной оспы, но и патогенных для человека вирусов оспы обезьян, оспы коров и оспы вакцины. Создана Атенуатированная живая противооспенная вакцина 4-го поколения, которая в настоящее время проходит клинические исследования в России. Разработан высокоэффективный противооспенный химиопрепарат Neox-14, ведется активный поиск новых препаратов, направленных против других молекулярных мишеней ортопокс-вирусов. На данный момент мы можем чувствовать себя более защищенными от возможного возврата оспоподобного заболевания, чем, скажем, 10-20 лет назад. При этом необходимо продолжать научные исследования вируса натуральной оспы и близкородственных вирусов оспы обезьян и оспы коров с целью разработки новейших методов диагностики, профилактики и терапии ортопокс-вирусных инфекций человека. И в заключение, уважаемые коллеги, хотел бы еще раз поблагодарить Всемирную организацию здравоохранения за организацию этого мероприятия и поздравить всех нас с годовщиной исторического события – сертификации искоренения натуральной оспы. Благодарю вас.
Spasiba, Ambassador Gatilov. It's my pleasure now to turn to Ambassador Bremberg, representative of the United States of America.
Thank you. Thank you. I am honored to be here today to commemorate the world's greatest international public health achievement, the certification of smallpox eradication. The discovery of the last naturally occurring case in October 1977 was a historic moment that concluded a chapter of humanity 3,000 years long. The 20th century alone saw 300 to 500 million people die globally from smallpox. The effort to eradicate smallpox faced and overcame severe challenges from famine and war to floods. However, it is due to the WHO's leadership, strong cross-country collaboration, and the tireless efforts of health professionals around the world that we are able to celebrate today. Multilateral action was integral to this achievement, but it was the workers in the fight, in canoes and trucks, who led the way in surveillance and vaccination. The perseverance of those on the front lines, the ingenuity of researchers, and the willingness of everyone involved in the eradication effort to learn and adapt serve as an inspiration for eliminating other infectious diseases we face today. And I want to take a moment to thank and remember a early mentor and colleague of mine, Dr. D.A. Henderson, who helped lead the eradication effort as a young public health policy analyst. When I served in the Bush administration, I had the opportunity to work with him when he rejoined the U.S. Department at the time. And he spoke repeatedly and powerfully about the importance of U.S. leadership and of world multilateral coordination that had led to the successful smallpox eradication. Of course, in the United States, and as my colleague just mentioned, I was never vaccinated for smallpox because of our successful eradication efforts that led before I was born. And I just want to thank him in particular, and all those who did so much to lead to this incredible milestone. When Edward Jenner introduced the smallpox vaccine in 1796, it was the first successful vaccine that could not only protect individuals from acquiring smallpox, but could protect people from the deadly effects of smallpox infection, even if administered several days after exposure. With this pioneering vaccine, we broke the chains of disease transmission, a first for humanity. Our shared triumph over smallpox paved the way for the success of other vaccination programs, strengthening the health of individuals and communities around the world. Upon achieving smallpox eradication, The world didn't simply sit back and applaud its accomplishment. The WHO and its member states immediately sought to expand immunizations globally. Smallpox success has inspired current efforts to eliminate other infectious diseases, such as the Global Polio Eradication Initiative, which I hope we can finally get to the finish line. The U.S. has been a leader and partner in this effort for years and will continue to do so, and I really hope that with the WHO's leadership, Tedros, and other member states, we can finally achieve this really monumental, important public health outcome. It's been too long, and it needs to be finished. The ring vaccination strategy developed to combat smallpox continues to be the basis of public health campaigns, including the current effort to control the Ebola outbreak in the DRC. This unending persistence and commitment to improving public health is what we are here to celebrate, working together to prevent the spread of infectious disease and saving these millions of lives. And I just want to close, as you can tell, this is an area that is personally important to me. This is what I've worked on early in my career. I will be very actively involved in supporting but challenging the WHO and the international community to continue to make the necessary investments and changes in the field that need to be done to achieve these important public health outcomes. I think the success of the smallpox eradication is a sign it can be done. It is difficult, it takes hard work, but I want to leave the room with no doubt of the U.S.'s commitment to leading and working in partnership with other countries in this space. So I'm happy to be here new in Geneva, but I'm thrilled that I could participate today. So thank you, Tedros, and thank you, everyone.
Thank you, Ambassador Bremberg. It is my pleasure now to invite Ambassador Braithwaite, permanent representative of the United Kingdom of Great Britain and Northern Ireland. You have the floor.
Thank you very much, and thank you, Director General, and to the WHO for inviting the UK also to celebrate this special occasion with you to mark this historic achievement in global health. Smallpox was a disease that affected us all, and in the case of the UK, right up to the end, where the world's last cases were recorded in late 1970s, a bit over 180 years after the first smallpox vaccination that Ambassador Bremberg referred to by Dr. Edward Jenner in England back in the late 18th century. The scale of this achievement is almost impossible to overestimate. I mean, smallpox, as we've heard from Ambassador Bremberg, killed more people in the 20th century than both world wars combined. I mean, it's extraordinary. I mean, the numbers are actually, when you think about them, absolutely extraordinary. It's true, it also remains so far the only successful global eradication campaign, but it has been the inspiration for the remarkable global effort to eradicate polio that has come so far and just remains extant in just two very difficult to reach areas, but the WHO is doing a remarkable job with support from us and others in that final lap, and I think we can take inspiration today from the achievements on smallpox to push that final mile in the polio eradication process. Much has already been said today, and so I'm going to look forward actually to what we could achieve perhaps in the future. Since the eradication of smallpox, the continued successful development and use of vaccines has dramatically improved the lives of millions of people. And it's important to recognize this progress, but also acknowledge that in some ways we have also now become the victims of our success. We're in a critical moment, as has already been mentioned, where the need for vaccines, their safety and effectiveness are being questioned and actively attacked by some. If we are to tackle vaccine hesitancy, we must get better at listening to concerns and questions rather than discounting them. We must empower people to ask questions and provide our health workers with the tools and training to give answers. In this age of so much information, it is normal and healthy that people take an interest in what is being provided to them. We must be ready to explain in a way that is easy to understand what we're doing, what is in the vaccine or medication, why it is so important, and discredit misinformation at every opportunity. If we're to access and build trust in communities, we must also realize that their needs may differ from our priorities. So again, we need to get better at listening and providing a holistic range of services to cater for those needs. The point is particularly relevant for the polio program at the moment, as we've discussed, which is facing these difficult challenges in these two very remote and difficult to access areas. The UK, like the other two countries on this panel, is a major donor to the World Health Organization and the Global Polio Eradication Initiative, and also to Gavi, the Vaccine Alliance, all of whom are working with many others to address these challenges. We cannot underestimate the importance of collaboration and the need for the global community to come together to ultimately reach a shared goal. The UK will also be leading the replenishment of the Gavi program later in next year, in the middle of next year, and we very much hope that we will be able to not only replenish the program but also go further. So thank you again for inviting me to here today to celebrate this momentous anniversary in the history of global medicine and global health. Thank you.
Thank you, Ambassador Braithwaite. We move now to a short collection of more personal perspectives, and we'll start this section of the program with a video address from our regional director for the African region, Dr. Moeti. Are we ready with the video?
It's a very special privilege and pleasure for me to address member states of the WHO Africa region, communities and health partners as the world celebrates the 40th anniversary of the certification of the eradication of smallpox. This is our greatest public health achievement and an incredible achievement too for humanity, with millions of deaths prevented. It's been a wonderful inspiration for me personally in my work in public health, in challenging areas like HIV/AIDS, in which I've worked extensively. I feel very proud to have a personal connection to it. Both my parents worked in public health, and my late dad, Dr. Simon Moeti, was a member of the Global Commission that certified smallpox eradication. As a teenager home from boarding school and later a medical student and young doctor, I used to listen to his accounts of traveling far into the bush tracking cases, then later visits to other countries for commission discussions. Last year during the World Health Assembly, I came across a photo of my father in one of the offices at WHO headquarters. He was standing among the experts of the Global Commission. I couldn't hide my emotions at seeing my dad among these experts that had worked tirelessly to eradicate and subsequently certify the world as being free of smallpox. The success of smallpox eradication has convinced me that polio eradication is possible in the African region and in the world. As regional director, the first thing I did was to bring the coordination of all polio eradication activities under my direct supervision. The next was to work with partners to strengthen coordination in all our work, especially the Lake Chad region, which was the hotspot for polio transmission at the time. Many of the tools that we are using to eradicate polio are the same ones used for smallpox: international collaboration and commitment, surveillance, and routine immunization and mass campaigns. Now, we also have the benefit of new technologies such as geographic information systems to improve surveillance and service delivery in real time. We innovate based on evidence every day. Then and now, community support is vital to success. Local leaders, community health workers, and individual community members understanding and playing their role. Frontline workers and communities did a fantastic job on smallpox eradication and continue to do so in polio eradication efforts. We owe them special recognition, particularly those who sadly lost their lives serving these noble causes. We look forward next year to certification of wild poliovirus eradication from the African region and to leaving the great legacy of stronger routine immunization, surveillance, and primary healthcare services in countries. Let's build on these tremendous achievements. And I'm certain that my father and other leaders of smallpox eradication are wishing us success.
Thank you to Dr. Moeti for taking the time, for sharing her personal story and perspective. And now, so that no one's feet go to sleep and to keep the program lively, I would like to invite the Director General and our special representatives of member states for the unveiling of the plaque in commemoration.
So together now we pull, huh? Okay. Yeah, Julian, here with me, and two from that side. Yeah. Okay. And Dr. Moeti's daddy is one of those guys, yeah.
Thank you, Your Excellencies, Dr. Tedros. If I may express, it seems difficult, in fact, to reconcile the monumental nature of such an achievement with the simple revelation of a plaque in commemoration of all those lives of the people who were affected, killed by the disease, but also of those who worked tirelessly for its eradication. So it's my pleasure now to invite Dr. Tedros for a few reflections.
Yeah, thank you, Joel. Your Excellencies, Ambassador Gatilov, Ambassador Julian Braithwaite, Ambassador Brimberg, Excellencies, distinguished guests, dear colleagues and friends. It's such an honor to be here with you today to commemorate the 40th anniversary of smallpox eradication. I remember walking through the streets of Asmara with my mother as a small boy and seeing posters about smallpox in the streets. This was in early 70s. And that's when actually for the first time I was exposed to WHO. And in our language, we call it wuddub alam, wuddub ta'na alam. So that was the first time. And not only about smallpox, but started to really understand about WHO itself. And by the way, not related to this, but I'm also the first Director General that was a scholar of WHO itself. My master's was WHO scholarship. So I have two attachments in my life with WHO. And I can claim that I'm the closest to WHO from all DGs. And of course, when I leave office every evening and when I come in, actually, when I see the statue, what I remember is the street in Asmara where I used to walk with my mother, and fresh memories of the smallpox eradication effort. So this plaque today recognizes the day, the 9th December 1979, when smallpox was confirmed to have been eradicated. 5 months later, the 33rd World Health Assembly officially declared that the world and its peoples have won freedom from smallpox. When it comes, of course, today, smallpox is the only human disease ever eradicated, a testimony to what we can achieve when all nations work together. When it comes to epidemic disease, we have a shared responsibility and a shared destiny. With this plaque, we commemorate the heroes around the world who came together to fight smallpox and work to keep future generations safe. Until it was wiped out, as you know, smallpox has plagued humanity for thousands of years, killing more than 300 million people in the 20th century alone. The smallpox eradication program taught us many lessons which we still use today. Our experience with smallpox informs the strategies and tools we now use to fight polio and Ebola, such as disease surveillance, health promotion, and ring vaccination. We use the lessons learned from smallpox when we take on emerging epidemic diseases such as Zika, MERS, and now monkeypox. Smallpox also laid the foundation for national childhood immunization programs worldwide, which are critical to primary health care and the movement for universal health coverage. At the same time, smallpox preparedness remains at the heart of global health security initiatives to protect people everywhere. Yet today, we're facing a lack of trust in public institutions, widespread vaccine hesitancy and disinformation, as Ambassador Julian said, and glaring gaps in our immunization coverage for the most vulnerable. The result has been catastrophic. Globally, measles killed 140,000 people last year, many of them infants and young children. The fact that any child is afflicted by a vaccine-preventable disease such as measles is an outrage. Yet, less than 70% of children worldwide are getting the second dose of measles vaccine when it should be 95%. Globally, there are more than 13 million children, many of them in fragile states and conflict-affected countries, who are entirely left out of vaccination services. We're not protecting the world's most vulnerable children. This is a collective failure. The success of smallpox eradication shows us what is possible and has allowed us to dream of another major public health achievement, the eradication of polio. We have brought polio to the brink of eradication, but we are not there yet. We must continue with even greater commitment and determination until polio is eradicated. As you know, the last mile is the hardest mile. And let us remember the smallpox vaccine was invented, as has been said, in 1976 by the English physician, Dr. Edward Jenner. By the way, I was reading about him earlier, a very fascinating man, and he was born May 1749, which is, he will be 271 years old on May 17 when we start our assembly in May 2020. To the day, actually. And this commemoration will continue until December next year. And during the assembly, we will have a special session also for smallpox eradication that can give us the energy to do more. But I was surprised to see May 17 is the opening and May 17 is his birthday. And of course, Dr. Jenner predicted that the annihilation of the smallpox, the most dreadful scourge of humanity, must be its final result of the vaccine, of course. So he predicted it of this discovery. And the three countries here had a big role, and as Ambassador Gatilov said, the USSR proposed the eradication, and Dr. Henderson led the effort. And thank you so much to you and all who have participated in ending smallpox. In fact, as we have said earlier, it took nearly 200 years. And I hope polio will end soon, so we have another statue as soon as possible and another plaque. So, but the lesson from smallpox is very clear. Technology is not enough. The best vaccines in the world do not help us if people are not getting them. And as Ambassador Gatilov said, this achievement was done in the middle of even the Cold War. So anything is possible, and we cannot have any excuse, by the way, from eradicating polio or others. So we must invest in immunization programs, public health communication, and strong primary care, but above all, the global solidarity, which was really visible and which we should celebrate, a solidarity within differences, but that was not actually a barrier. So that's the only way we can achieve health for all, protect people from these devastating outbreaks, and make the world a safer place. And finally, I'm really proud to join you and hope this will inspire us to do more to serve the people we serve. Thank you so much. Thank you.
Thank you, Dr. Tedros. I understand that there are participants in the room who may, for one reason or another in previously scheduled events, have to make their way now. Thank you very much for being with us. We're very fortunate, as was referred to by Ambassador Bremberg, to have some of those people who were working in canoes, in trucks, to do everything necessary to eradicate smallpox with us today. And it's my great pleasure to introduce Dr. Danielle Tarantola and John Copeland, who worked for the smallpox eradication program. We will start hearing from Dr. Tarantola, please.
Thank you very much, and thank you, Dr. Tedros, and honorable members of among these participants to organize this event. I will address, I'll express my few comments in French. Dr. Tedros, je voudrais tout d'abord dire que la chose la plus essentielle que je retienne de cette campagne, c'est qu'il n'y a pas d'autre organisation que l'OMS qui aurait pu exercer ce rôle de timonier pendant l'éradication de la variole. Je le dis parce que ce leadership a été mis en cause parfois, a été critiqué, et je crois que l'accomplissement de l'éradication de la variole est en grande partie dû à l'OMS et à ses parties membres, les États membres. La deuxième chose que je voudrais dire, c'est que j'ai eu l'occasion de travailler au Bangladesh en grande partie et que j'ai pu assister à la convalescence et à la guérison d'une jeune fille qui avait 5 ans, qui s'appelait Raima Banu, qui était le dernier cas de variole majeure, celle qui tuait beaucoup, 15-20% de létalité à l'époque. Et je l'ai retrouvée 30 ans après, comme la mère de 3 enfants. Elle vivait toujours au Bangladesh, mais non plus sur son île, dans la baie du Bengale, mais dans la région de Dhaka, la capitale. Je n'ai pas eu l'expérience de la Corne de l'Afrique, comme on dit, mais bien sûr, je fais partie d'un club qui inclut beaucoup des anciens de la Corne de l'Afrique en matière de variole. Je fais partie de ce réseau plutôt que d'un club des anciens de la variole. C'est un club qui rétrécit d'année en année, qui ne prend pas de nouveaux membres, j'espère qu'il n'en prendra jamais. Et c'est donc en leur nom, mais aussi au nom des centaines de milliers de travailleurs de terrain qui n'ont jamais eu vraiment de récompense, sinon celle personnelle d'avoir participé à cette éradication, et que l'on cite assez peu souvent. Je dois dire, et étant un ancien membre de l'OMS moi-même, je peux me permettre une petite critique de cette organisation, que nous, les éradicateurs, comme on les appelait, n'étaient pas très populaires au sein de la variole, au sein de l'OMS. Nous étions trop jeunes, nous étions trop informels, beaucoup avaient les cheveux longs et portaient des jeans. Nous ne nous conformions pas au costume 3 pièces qui était à l'époque la norme. Et de plus, nous appliquions un programme que l'on qualifiait de vertical, c'est-à-dire de paramilitaire en quelque sorte. C'est une des raisons pour lesquelles, lorsque l'éradication, la certification a été prononcée, il y a eu relativement peu de bruit qui s'est fait autour de cet événement. Bien sûr, une Assemblée mondiale a noté que c'était accompli, les médias ont repris ça pendant quelques jours, et puis ça s'est arrêté là. C'est 40 ans après qu'on continue, ou on commence, ou on favorise la mémoire de cet événement qui était malgré tout un événement historique très important. Je crois qu'une des raisons de ce relatif silence, c'est que les méthodes appliquées à l'éradication de la variole paraissaient ou étaient vues comme s'opposant aux méthodes intégrées des soins de santé primaires qui étaient dans le parler, dans le débat public le plus souvent à l'époque. Cela dit, je voudrais faire 3 brefs commentaires, sachant que mon temps est très très limité durant cette réunion, pas dans ma vie. D'une part, cette éradication est un événement historique extraordinaire. Je ne ferai pas la liste des programmes qui ont bénéficié des leçons tirées de l'éradication. Je dois dire qu'il y a une maladie qui a été éradiquée en appliquant les méthodes d'éradication de la variole, qui n'est pas une maladie humaine, mais qui impactait énormément sur la survie des populations vivant dans l'est de l'Afrique, que l'on appelle rinderpest, qui est une sorte de rougeole du bétail, et qui tuait, et la méthode d'éradication appliquée à la variole a été appliquée au rinderpest, et l'interruption définitive, l'éradication du rinderpest a été prononcée, je crois, en 2011. Donc c'est une méthode réplicable, adaptable, et dont on doit se souvenir. Elle n'est pas universelle, il y a beaucoup de programmes qui ne pourraient pas appliquer cette méthode directement, bien sûr. La deuxième remarque que je voudrais faire, c'est ce sens que le docteur Tedros a signalé, qui est celui de la solidarité mondiale. Le groupe des gens qui ont travaillé à la variole, quelles que soient leurs origines, quelles que soient leurs orientations politiques, quelle que soit leur place de résidence, forment véritablement une famille. Je peux aller dans n'importe quel pays du monde et rencontrer, un petit peu comme un Rotary Club fait sur mesure, des gens qui ont participé à l'éradication de la variole, il y en a de moins en moins, mais il y en a encore, et les reconnaître comme des amis parce qu'on a vécu ensemble cette expérience. Il faut se souvenir, ça a été aussi signalé par le docteur Gatilov, que l'éradication de la variole a coïncidé avec un des plus mauvais moments de la guerre froide. Et on tirait d'un parti qu'on appelait le bloc Est ou le bloc Ouest, le meilleur qui pouvait être tiré. On tirait des personnels, on tirait des ressources, on tirait de la science. Les laboratoires de référence de la variole étaient à la fois en URSS à l'époque et aux États-Unis et dans d'autres pays, etc. Il y avait une solidarité telle que ces gens qui travaillaient ensemble faisaient abstraction totale de leurs origines ou de leurs choix politiques. La seule chose qui nous soudait, c'était un objectif extrêmement simple, c'était smallpox 0, la variole 0 cas, c'était ça. Enfin, je terminerai en citant une troisième réflexion qui est que la variole a connu en quelque sorte le début de ce qu'on appelle aujourd'hui la diplomatie de santé, le global health diplomatie au niveau mondial, où les enjeux créés par des problèmes de santé deviennent véritablement des enjeux politiques. Je dois signaler ici que l'échec des politiques de santé sont très souvent l'échec des États. Et je ne blâme aucun État, nord, sud, est, ouest, mais ce sont des échecs structurels et systémiques qui amènent à avoir cet horrible nombre d'enfants morts par la rougeole l'année dernière, 140 000 enfants. Et on continue à négocier, à parler d'une amélioration de la santé au cours des années. Alors je me tourne vers le docteur Tedros et je lui demande si le temps est venu d'amener les politiciens, non pas seulement les ministres de la Santé, mais les politiciens des Nations Unies et du Conseil de sécurité des Nations Unies sur le fait qu'on a perdu 140 000 enfants l'année dernière et que ça va être encore pire cette année. Et je crois que le Conseil de sécurité a pris des résolutions de ce genre pour le VIH-Sida 2 fois, une fois en 2000 et une fois en 2010, donc c'est 2011. Donc c'est tout à fait dans la corde de ce qui les intéresse, c'est la sécurité mondiale du point de vue de la santé et de la survie et du développement des enfants. Merci.
Merci, Dr. Tarantola. And now a few reflections from Mr. John Copeland.
Merci beaucoup. Daniel a parlé de façon globale, je parle d'une façon beaucoup plus personnelle. Je suis ici comme le dernier survivor, le seul survivor de l'original core group that started smallpox program. I'd like to think this is due to good genes, but I think it's just that I was the youngest member of the group. But today is a chance for me to realize that all those hundreds and thousands of young, healthy health workers are now over 60. Anyone who is in a leadership position is now much older or dead. And so that even the Director General, as he said, when we were working in Ethiopia with Ciro de Quadros and Kurt Weitaler and the Peace Corps and helicopters, the Director General was a little boy with his mother walking in the streets of Asmara. But it's a chance for me to think back, and I'm grateful to all of you for this chance for me to go down memory lane. Thank you very much.
Thank you, John Copeland. And as several speakers have already indicated, looking to the future and the last part of the job to eradicate polio from the earth, we now will hear from Dr. William Mbabazi, who is an expert in routine immunization and has worked in South Sudan and Somalia, now working in the polio eradication program.
Thank you very much, and thank you for the opportunity to speak to you as an active and currently serving staff here in WHO headquarters. Just to begin with, after the two previous speakers, I want to say when I grow up, I want to be like them. Having said that, I am first of all humbled and exceedingly honored that I'm sitting here actually, and the director just walked out, so she couldn't hold on to her remarks, so I'll try to fill the shoes. As a current EPI and polio program staff, we live in the memories of the smallpox eradication program. We cherish these men and women that you see before us here. They have shared all their experiences, all their knowledge, and all their wisdom that they acquired in those deep jungles and corners and all the difficulties that they actually went through. It is what actually we are building on today to actually continue to do the work. First of all, in the fields for polio eradication, but also for building the backbone that is EPI globally. We've learned a lot from the smallpox eradication program. And I'm not going to talk about the plaque, but I'm going to just highlight 3 or 4 of the major lessons that we have learned and continue to inspire us today. 1, we've learned that they had shortages of vaccines. We are currently having shortages of vaccines in the polio eradication program, and we can assure you the shortages will not deter us from the end goal of seeing a world free of polio. The smallpox eradication program lacked funds, lacked human resources, and it actually lacked sometimes the commitment of member states. We are leaving the same trail of shortages and lack. But I assure you that we will neither lose our resolve to reach the end goal despite all these hurdles that are presented before us. In the times of smallpox eradication and reading through around 1965-66, there were very many outbreaks of smallpox in Americas, in Africa, in Asia. We seem to be at that same point. There are several outbreaks of vaccine-derived outbreaks in Africa, in Asia. Their wild poliovirus case count is skyrocketing in the Middle Eastern countries. that will not break our backs, to rise above and seek for new solutions to get the job done in the polio eradication program. I want to assure you that we've learned that you needed new vaccine products. We are working on new vaccine products. Shortly, you'll be hearing about the novel oral polio vaccines. You'll be hearing about the measles, rubella microneedle patches. You'll be hearing many new vaccines, including the new malaria vaccines. All that we are following in the footsteps of the the change from the cowpox virus to make smallpox vaccines to variola virus-based vaccine products. We will go all the way to explore whichever route you took. We will retrace it and make sure that we get to the finish line. The last one I want to highlight is the containment of the polio, the variola virus. It's been 40 years. No one wants to celebrate that this virus is still around and is properly contained in some very highly, contained facilities. We will go that route. We will definitely contain all the polio viruses that we are fighting, the measles viruses, the rubella viruses that we are fighting. We will make sure that they are contained. Once relegated into the archives of history, we will not see them. We will use the same methods that you guys have used for over 40 years to keep variola vaccine in containment containers. We're also not short of things we have to unlearn. That smallpox eradication was possible without a strong EPI. We've learned the hard way, and we now know, and back to the vision of Tedros, we are not only committed to universal access and universal coverage, but we are actually committed to universal utilization of all essential immunization services so that we can see most of the vaccine-preventable diseases are under control. In a nutshell, we relish the memories. We have learned all your lessons. We know that these commemorations sound like it was all rosy, but we've learned the hard lessons you went through and went over to achieve the eradication of smallpox, and we'll use the same tools, the same path, we'll trace them to finish the job at hand. I thank you.
Thank you, Dr. William Mbabazi. Excellencies, representatives, special guests, Dr. Tedros, colleagues, ladies and gentlemen, this brings us to the end of this formal program. If you, like me, are having a slight blood sugar dip and find yourself affected by the also emotional content of such a special occasion, we have foreseen some refreshments just outside the salle, and you are invited to take a few moments and reflect on your experience of this commemoration and others in global public health. We thank you very much for taking the time today to be with us for such a moment, and as Dr. Tedros said, there will be other moments in this year where we celebrate and become inspired again by this achievement. Thank you very much.